What you need to know about kidney stone management using a percutaneous nephrolithotomy. Kidney stones are extremely common. More than 500,000 people visit the emergency room each year with kidney stones, and it is estimated that 1 in 10 people will have a kidney stone at some time in their lives. When kidney stones are too large to treat with other modalities, your urologist may recommend a percutaneous nephrolithotomy or PCNL. During a PCNL, a tube will be placed into the kidney through a small incision in the back. Then, an instrument is passed through a rigid scope called a nephroscope to break up the stone and remove fragments from the kidney. After removal, a stent or drainage tube is placed temporarily as the kidney recovers. Traditional techniques for this surgery often involve a hospital stay. However, our urologic surgeons are pioneers of tubeless mini PCNL, which is performed as same-day surgery. Here's what you need to know about preparing for the PCNL. Depending on existing imaging and urine studies, we may ask you to repeat some testing before your procedure. If you take a blood thinner, we will ask you to hold it before surgery. The exact number of days the blood thinner should be held will be coordinated by your urology and primary care teams. You may be asked to take an antibiotic before surgery. If needed, the details of the type and duration of antibiosis will be coordinated by your urology team. The night before, make sure you have nothing to eat at least 8 hours before your scheduled procedure. You may be able to drink clear liquids such as water and Gatorade several hours before the procedure. Your anesthesia team will discuss the details of which clear liquids may be allowed. On the day of the procedure, you will be asked to report to admissions at least 2 hours prior to your scheduled procedure time. Following the surgery, you will expect to stay in the recovery room for roughly 2 hours before being prepared for discharge. In most cases, you will be discharged home with 3 medications: a pain medication, usually ketorolac, a medication to relax your ureter called tamsulosin, and a medication to prevent bladder spasms, usually Vesicare or oxybutynin. Most patients will have a stent placed after the procedure. A stent is a small internal tube that helps protect the ureter. If the tube is left on a string, you will be given instruction on how to pull the string to remove the tube after surgery. If the tube is left without a string, we will contact you to set up an appointment to come back to our office for a stent removal with one of our providers within 1 to 2 weeks. Please refrain from strenuous activity of lifting more than 5 pounds in each hand for 1 week after surgery. You should expect to see blood in the urine for up to a week after surgery. It is also common to experience burning in the urethra and discomfort in the back with urination. While PCNL is generally a safe procedure, as with any surgery, it does carry some potential risks. The most common risks are the following. Sometimes, because of the large amount of stone in the kidney, the procedure does not fully clear all the stones. If this occurs, you may need to have continued observation of stone fragments or a follow-up procedure to remove them. Often, stone can harbor bacteria which can be released during stone fragmentation. For this reason, we check your urine studies before and provide antibiotics during the procedure. Nevertheless, urinary infections can occur in 0.3 to 0.5% of patients undergoing PCNL. The procedure also carries a small risk of bleeding, which in very rare cases can require blood transfusion or subsequent interventions. This rare complication occurs in less than 1% of cases. Though very rare, there is also risk of injury to surrounding organs such as the lung, liver, spleen, and bowel. As with any surgery, there is a potential for needing additional procedures following initial surgery. Please let us know immediately if you experience fevers, chills, or inability to urinate, or if your urine suddenly becomes significantly more bloody. 6 weeks following the procedure, you will need to complete repeat imaging studies, usually a CT scan or an ultrasound, as well as a 24-hour urine collection. 3 months after the procedure, we will set up a virtual visit to discuss all the results above and formulate a plan for preventing stone recurrence. Thank you for choosing our urology team, and please reach out to us with any questions.